Welcome to The Explainer. Today, we're getting into a really tough but super important topic, schizophrenia in teenagers. What happens when a serious mental illness shows up during what are already some of the most chaotic and transformative years of a person's life?
Okay, so to help us unpack all this, we're going to be pulling insights directly from the first 5 chapters of this really key text. We want to get a solid handle on what the science actually says is going on inside a teenager's mind. And that's the big question, right? Why adolescence? Why this specific window of time? Well, it turns out the answer is right there, inside the teenage brain itself, a place that's going through some massive and sometimes risky changes.
All right, first up, let's think of the adolescent brain as a giant, busy construction site. A ton of potential, but also a place where things can easily go wrong. So during these years, the brain isn't just growing, it's doing this huge fundamental rewiring. It's a process called neurodevelopment, and it's exactly what makes the teenage mind so dynamic and, able to learn and adapt so quickly.
Okay, so check this out. The brain is basically trying to upgrade itself into a high-performance machine. It's doing a couple of really crucial things. First, there's synaptic pruning. This is where it gets rid of inefficient, unused connections. Think of it like clearing out old dead-end roads to make traffic flow better. At the same time, you've got myelination, which is like insulating the important remaining pathways so signals can just fly down them, turning those main roads into superhighways. But here's the catch. This whole renovation project is super delicate. If the wrong connections get pruned, or if that insulation isn't laid down just right, you can end up with these fault lines in the brain's setup. And that's where the risk for disorders like schizophrenia can start to creep in.
So what happens when those fault lines we just talked about start to cause problems? Well, they can mess with the very blueprint of our minds. I'm talking about our core cognitive skills, like how we remember things and just process the world around us.
And the research on this is crystal clear. Schizophrenia is tied to some very specific problems in how the brain grabs, holds onto, and uses information. And look, we're not talking about minor memory slips here. These are fundamental issues that really affect daily life, and they're often kind of hidden compared to the more famous symptoms people think of.
Two areas in particular seem to get hit really hard. First is visuospatial memory. That's basically your brain's internal map for remembering shapes and locations. The other is working memory. You can think of that as your brain's mental sticky note, where you hold info for just a moment to work with it. Study after study shows that teenagers with schizophrenia have a tough time with both, and these issues are now seen as a core part of the illness itself.
Okay, this next part is really fascinating, and honestly, a super important shift in how we think about this. It turns out psychotic symptoms don't just pop up out of the blue in a handful of people. The building blocks for them, well, they actually exist on a spectrum across the entire population.
Now, a full clinical diagnosis of schizophrenia is pretty rare. We're talking about a lifetime risk of about 1%.
But, and this is wild, the experience of having at least one isolated psychotic symptom, like a brief hallucination or a paranoid thought, is way more common than you'd think. One study found that up to nearly 59% of teenagers reported having an experience like that. Just let that sink in. That's a huge number.
And this gets us to the modern way of seeing psychosis. It's not an on or off switch, it's a continuum. The experiences are out there in the general population way more than the actual disorder is. And why does this matter? Because it means these isolated symptoms could be really important red flags, right? They might help us spot who needs a little extra support before things get more serious. Okay, so understanding the brain and the symptoms is one piece of the puzzle. But what do we do about it? Let's check out a pretty cool and innovative approach that treats therapy less like a solo performance and more like a team sport.
The basic idea is this. When an illness like this has really fractured a young person's sense of who they are, it's too much for one therapist to handle alone. The emotional weight is immense. So instead, you bring in a whole team of caregivers to work on it together.
And how this works is pretty incredible. The team basically becomes this collective brain. They hold on to all the scattered pieces of the patient's history and their experiences. Then, together, they work through it all to try and make sense of the conflicting parts. And only then do they help the patient start to put their own story back together. It's a really powerful way to help someone rebuild their sense of self from the ground up.
But therapy isn't always straightforward. It also has to deal with some of the tougher, more misunderstood behaviors that can come with the illness. And that brings us to the really complex topic of how to manage aggression. Here's the thing you absolutely have to get. There is no single easy answer for why aggression might show up. It's not some simple symptom with a clear cause. And because of that, there's no way there can be a simple one-size-fits-all treatment. It's just not that easy.
So what works? Well, it takes a much broader, multifaceted approach. You have to look at the brain biology, for sure. You also have to look at the psychosocial stuff, what's going on in their life, their environment, their stressors. And then, yes, sometimes medication is part of the picture, but it has to be used carefully as just one piece of a much bigger, more comprehensive plan. So, wow, we've really covered a lot of ground in a short time. We've seen that adolescent schizophrenia is at its heart a neurodevelopmental thing, rooted in that brain construction phase. We've learned that its symptoms are actually on a spectrum across all of us. And we've seen that the best treatment isn't a single pill, but a compassionate, team-based approach.
And all this kind of leaves us with one big question to chew on. What if the future of treating complex mental illness isn't about finding that one magic bullet? What if it's really about getting better at weaving everything together? The hard brain science, the creative therapy, and just basic human connection.